baldness, which is almost grade 6 to grade 7 baldness case, and which the hair density is pretty negligible in the hairline, front area, mid-frontal area, and the vertex area. Also, the hairs in some of the areas are grey, so we have dyed some of that region so that we can extract out the hairs in a better way. So we are planning to cover the frontal half of this patient in this first go, and which we will extract the hairs from the scalp. We will also be extracting some hairs from the beard area, because the hairs in the scalp as such are not sufficient in number. So we will be extracting about 3000 grafts from the scalp. The remaining grafts we would be taking from the beard hairs. Scalp hairs usually contains on an average 2 to 3 hairs in each graft or in each follicular unit, while in scalp hairs usually this ratio is about 1 to 2 each unit. But the beard hairs are of good thickness, so they complement with the scalp hairs pretty well and gives a better result. Okay, so now, and we have applied Trilox, which is a topical anesthetic cream to diminish the pain which we will be doing. We would be giving anesthesia in the front, and we'll be making the hairline design first, and then we would be extracting out the follicles and implanting the follicles in subsessions. So we will be extracting few follicles, about 1000 follicles first. We'll put them first so that the out of the body time is less than 1 hour. So this is how we are planning to do the procedure. This procedure in total will take more time because we are planning to take hairs from scalp as well as beard hair. Today itself this procedure might go to about 12 hours or so. But time does not matter in this procedure. More important is to maintain accuracy and to make the result look as natural as possible. Okay, so now we will start the procedure. We will clean the topical anesthesia. We will do a betadine head bath first, and we'll design the hairline. Okay. This is called supraorbital block. This blocks the nerves which takes the hair, the sensory pathway of the front area of the scalp and the central part. So this anesthetizes this whole area. So can you feel here?
Sorry?
Can you feel any pain here? I'm pricking your needle. Can you feel a pain?
No.
Okay. Here?
Nope.
Okay.
That's good.
This is a surgical marker. It's a sterile surgical marker. So usually we keep the hairline point at roughly about 4 fingers from the center. This is the standard procedure in hair transplantation, to keep it about 4 fingers breadth from the eyebrows.
Okay.
In the side area, we would be taking hair slightly back.
Okay.
That gives a more masculine look.
Okay.
And secondly, because yours is a case of more advanced baldness, so we need to conserve hairs.
Right.
So we would conserve hairs on the sides, and we will put in more hairs on the back area.
Okay.
Okay. So that's how we are planning to do it. And your case, please. Okay, so you're fine with this hairline?
Yeah, I guess so.
Okay.
Yeah.
permanent hairs.
Oh, okay.
Yes. So basically, what we do is we anesthetize the area around. That's called tumescent anesthesia. On which your drilling is tight, then you would be able to drill it in a better way.
Correct, correct.
Okay. Yes. So it works on the same principle. Here each root you have to run that, but our hairs are arranged in kinds of units. Each unit contains this is the hair root. Like this unit contains 2 hairs, this contains 2 hairs. This is how units look. Extracting all of them. What is the difference? Everything?
They went to Greece.
In that time?
I'm not.
I'm not in. A little bit discomfort like that, sir? Okay?
Only in this area.
Central area. Okay, tablet अभी दिया है, देख लीजिए थोड़ी देर में
Hello, doctor. What is hair transplant?
Hair transplantation is basically a procedure in which hair follicles are basically taken off from the back area of your scalp and then transplanted on the desired area. Once the procedure is done, it is permanent.
Okay. So does it look natural?
Yes, definitely it's going to look natural because it's your own hair which is being transplanted on the desired area.
Okay. So who's the right candidate to go for hair transplant?
Okay, see what happens is any person who is developing thinning of the hairs or developing bald patches can undergo hair transplant.
Okay. So what is the minimum age to go for hair transplant?
A person as young as 20 years can go. The only concern is he or she should have a good donor availability. That is the availability of the hairs on the back area of the scalp.
Okay. So is it a painful procedure?
No, not exactly, because we give local anesthesia at the donor as well as the recipient side. So when the procedure is going on, transplant, there will be no pain. But when the anesthesia weans off, there might be mild discomfort for few days.
And so, from when, I mean, like, is it easy to maintain the hair transplant hair?
Nothing as such. You don't need to maintain or do. There's some post-op medicines which you have to take.
Okay.
That's it. But once it is done, the hairs will never fall.
Okay. Is it looks natural?
Yes, it does.
And then, so is it expensive, doctor?
Not exactly. It entirely depends upon what kind of procedure you're doing. It depends upon the extent of the involvement. It ranges from 50,000 to 5 lakhs. Entirely depends upon what technique you opt for.
Okay. So what are the kinds you have, doctor, in hair transplant?
We have FUT, we have FUE. FUT is follicular unit transplantation, which basically involves removal of the strip from the back of the area, and from them the hair follicles are taken out and transplanted. Then we have FUE technique, that is follicular unit extraction, in which we basically directly pull out the hair follicles with the help of an extractor, and that is transplanted.
Okay. Is it safe? So, is it a safe procedure, doctor?
Yes, definitely it is a safe procedure. It is a medically certified procedure done worldwide by various dermatosurgeons and cosmetic surgeons, so you don't have to worry about that.
Okay. Is there any guarantee? So is there any guarantee, doctor?
Yes, definitely, because the transplanted hairs are basically the androgen insensitive hairs. So once they are transplanted, they will never fall. So the guarantee comes with it.
Okay. Any side effects? Is there any side effect, doctor?
No major side effects are there with hair transplant, but yes, some minor or temporary side effects might occur. For example, there might be some swelling over the scalp, or some inflammation, or some kind of an itching along the hair follicle, but they also go off with the time.
Can I go for a haircut, in case if I'm going for a hair transplant? Is there any possibilities that I can shave my hair or like?
Yeah, after the hair transplant, after some interval, you can shave off the hair. Once the donor site is healed off, you can shave off the hair over that.
So what is the duration, doctor? Like,
see, with the advancement of the technologies, the healing time has reduced. Okay, so it takes just few days to few weeks to heal. Then you can socialize and party within a week's time.
In that camera, it's getting closer.
How many grafts are you lifting from this?
Around 1,000 to 1,012. Because beard hairs, beard hairs looks good.
नहीं ये वाला नहीं चाहिए, ये वाला
नहीं नहीं नहीं
नहीं, वो और नीचे नहीं होगा।
I will tell you the final amount of time of service.
No, not amount. Number.
Number, yes. You can very easily take that number into 3 digits. It's definitely not in 2 digits.
Oh, really?
Yes.
Obviously, it's going to be super happy.
Clean up it. I'm giving you anesthesia now. Can you feel here?
Sorry?
Can you feel here?
Yeah,
Here?
yeah,
Here?
yeah.
Here?
Yeah, that I can.
अभी पेन है?
अभी नहीं है.
Just when the solution goes in, you will feel some pain. Just relax.
perfect.
चलो बैठिए सर, इधर बैठिए। Okay, so now we are through with today's procedure. So we have covered the hairline area, frontal area, and the mid-frontal area up till here, as you can see. So we have implanted the hairs at a higher density of about 45 units per centimeter square in the hairline area, and as we're going back, we have reduced the density slightly. In this, because the a grade 7 baldness case, so that's why we had made a more conservative hairline in this. So we have kept much more deeper parietal temporal angles in this. So now post procedure is just we would be doing the dressing now, and in this we instruct patient to keep pouring in normal saline every 4 to 6 hours for the initial 2 days. Patient can start doing shampooing from day 3 onwards. All this white dots which you're seeing, this all are the units which each unit contains 2 to 3 hairs. This all units will turn into black crust, which will gradually stop falling, so this crust starts to fall by about 7 to 10 days. All the crust is gone by about 2 to 3 weeks, and then new hairs starts to emerge. Full response takes about 9 months to 1 year. By about 5 to 6 months, we can see a good enough result, but full response takes about 9 months to 1 year. This dressing and all on the donor areas can be removed just on the 3rd day, and then after 6 months we would be planning a second session to cover the remaining part, the vertex area for this patient. Okay. And about the procedure, people usually have a common myth that it's an extremely painful procedure, especially when we talk about extracting hairs from the beard area.
Right.
They feel that it's going to be extremely painful, and most people will not be able to endure it.
In the first 2 or 3 injections I felt, but it is like any other injection in the arm, or there are people who go for root canal and they've got to have injection in their gums, right? But after the first 2 or 3 injections, like you explained to me, when the zone starts to end, and then you are able to perhaps feel some sort of sensation, not pain, but the fact that you can feel a needle or some depression. Then I came to you, I said, no, I think I need some more. So, the controlled use of anesthesia, especially at the end of an experienced surgeon like yourself, is perhaps makes it, pardon the word, but a heck of a lot less painful than people make it out to be. Right? And the fact that you made those minor incisions on the head to plant the follicle inside, I never noticed even one of them. I mean, it felt like somebody was cutting carpet somewhere, but it went cut. That's all. I know if I can eat pain. And considering the amount of bio waste that I see around me, I should actually yelled and screamed according to those people who you say that it is extremely painful. Yes. Right? But it is not. I've been having fun. I walked out. I've had my lunch. I had a cup of coffees and teas. Right? So it's been all the more. It's not that painful. I mean, it is painful for the first 2 or 3 injections, but even that starts to dissipate away. Right? Which is why, once again, you need those experienced surgeons who are able to have the right dosage of anesthesia and the right way to do this and the right way to